So far we talked in detail about the conditions like acute esophagitis, burns of the esophagus, strictures of the esophagus, and then another very important condition associated with esophageal disorder is a hiatus hernia. So in this final and fifth section of our lecture, we will talk about the condition known as the Plummer-Vinson syndrome. How we will talk about how this condition present, what are the clinical features associated with Plummer-Vinson syndrome, how we can diagnose and treat this condition, and also we will go over another condition known as the globus pharyngeus or hystericus pharyngeus. So these are the things we will talk in our final and fifth section. So Plummer-Vinson syndrome, what are the features of this syndrome? How we can identify that this is the patient with Plummer-Vinson syndrome? So classical features are the dysphagia, which is difficulty in swallowing. So important thing to remember, any condition that is associated with the esophagus or any disorder that can affect the esophagus, dysphagia is common, which is difficulty in swallowing. Then iron deficiency anemia is present in Plummer-Vinson syndrome, or iron deficiency anemia can lead to Plummer-Vinson syndrome. That's another very, very important classical feature of this condition. Glossitis. There is tongue is affected, there is inflammation or infection of the tongue, there is fissuring of the tongue in this, that also can cause pain on swallowing. So this is the picture of glossitis. Angular stomatitis, there is a fissuring. Angular stomatitis is also present in Plummer-Vinson syndrome. Koilonychia. Koilonychia is the condition in which there is spooning of the nail. The nails are spoon-shaped. And this iron deficiency anemia can also lead to koilonychia. Patients who are anemic, they are low in hemoglobin or iron, they present with koilonychia, which is spoon-shaped nail. The nail is bent inwards. So that's the koilonychia. Achlorhydria, decreased level of HCl, hydrochloric acid, and atrophy of mucous membrane of alimentary tract. So all these are the classical features that give the condition known as Plummer-Vinson syndrome. And syndrome is the term used for aggregate of so many different conditions. So in this we have iron deficiency anemia, there is glossitis, angular stomatitis, koilonychia, achlorhydria. So all these together make up the Plummer-Vinson syndrome. Diagnosis of this condition is usually affects the females, are mostly affected after 40 years. Barium swallow is performed, which shows web in the post-cricoid region. So with barium swallow, we show web in post-cricoid region. Same seen on esophagoscopy due to subepithelial fibrosis. So we have, it affects the females after 40 years. There is formation of web in the post-cricoid region. So web formation, esophageal webs are present, and these webs are formed due to the subepithelial fibrosis. Plummer-Vinson syndrome, about 10% of the cases usually develop post-cricoid carcinoma. So esophageal webs are produced. These webs can also, in 10% of the cases, can progress to the carcinoma. Predisposes to carcinoma in tongue, buccal mucosa, in the pharynx, in the esophagus and stomach. So all these are the common sites in Plummer-Vinson syndrome in which the carcinoma can develop. Here if you see the ulceration or the mass present, that can be the carcinoma. So biopsy should be performed to find out if it is carcinoma or not. Treatment of the Plummer-Vinson syndrome, we already know the classical features of the Plummer-Vinson syndrome. So one by one, all the features should be managed or treated because each one of them have its own effects. So it can be managed according to the classical features of Plummer-Vinson syndrome. So treatment to correct anemia, iron deficiency anemia, we should give the iron, can be by orally if the patient can take oral, or parenteral iron. Serum level of ferrous is more important than the hemoglobin. So it's important to find out the ferric serum level to find out the deficiency of iron. Associated B12 and B6 should also be corrected. So B12 and B6 should also be monitored and corrected. Dilation of webbed area by esophageal bougie. So if there is formation of the web that develop in the post-cricoid region, that in 10% of the cases can progress also to the carcinoma, that should be also treated by the dilatation with the bougies. Important thing is to correct the anemia. We should monitor the level of the ferrous in the serum, and also we should give the iron supplements, and also we should correct the deficiency of vitamin B12 and vitamin B6. Next is globus hystericus pharyngeus. As the name show, hystericus, a lot of people who have anxiety or they have hysterical disorders, hysteria is present, they have this condition. So it is a functional disorder. Functional disorders are disorder in which there is no pathology present, but it's a functional disorder where the patient complain of lump in the throat. They feel they have a lump in the throat. On examinations, there is nothing present, so it's a functional disorder. Feeling of lump more marked between the meals. Fear of cancer in the throat. They feel they might have cancer in the throat. Clinical examination should be done, and usually it's a functional disorder, so on the examination nothing is present. Pharynx, larynx, base of the tongue, every structure is normal. But these patients, they have, usually you see patients like this, 1 to 2 cases who keep on visiting the doctors. They want to get admitted in the hospital, but they have no cause or no pathology. They are the functional patients and they keep on complaining about different things. Treatment is reassurance to patient when the cause has been found, when no cause has been found, because in this case no cause is present. So you just reassure the patient that there is nothing wrong, nothing serious, so they don't need to worry. That concludes our topic of disorders of the esophagus, in which we tried to cover all the important topics that are related to the disorders of esophagus. Thank you for watching sqadia.com.